So good evening, good morning, good afternoon, uh, distinguished guests, policymakers, senior colleagues, students, researchers. Good evening. Today I'm glad to welcome you to Chip Talk Africa April edition. I'm Grace Kia, the founder of War Against Rabies Foundation. I'm actually honored to have you guys here. So once again, welcome to Chip Talk Africa April edition, themed Securing the Chain of Evidence, integrating field clinical suspicion, laboratory readiness, and One Health coordination. So, CHIP mission is to promote One Health, empower the local actors, and tackle zoonosis, poverty, and climate changes in Africa. Uh, this is an initiative of War Against Rabies Foundation, and War Against Rabies Foundation was founded 2017, and since then we've been doing a lot of works in different communities in Nigeria, and we also have extensions to other countries where we have done collaborated with friends and partners to do a few works. We created this Chip Talk Africa platform because we believe that resilient communities are built through knowledge and coordination. And last month, we heard the raw stories from the field. Today, we are looking forward to we're looking at the infrastructure of elimination plus some more field reports. Nigeria's SARE score, SARE, some people call it, that stepwise approach towards rabies control and elimination score of 2 isn't just a number. It's a call to action for all of us. It tells us that our chain of evidence, the path from a suspected bite in a village to a confirmed result at the NVRI or any of the labs needs to be unbreakable. Presently in Nigeria, we have the NVRI that is the OIE, the OIE approved Center for Rabies Diagnostics. So from that village where a suspected bite is taking place to getting the result from NVRI, we can't afford the chain to be broken at all. So tonight we aren't just discussing rabies, we are discussing the systems that will save lives. I now hand you over to our moderators to introduce the experts who guard this chain. So tonight to moderate this meeting, we have Dr. Sarah Becky Paul and our student doctor, Kenneth Ta from Cameroon, of University of Brie. So I hand us over to Kenneth. Kenneth, student Dr. Kenneth, are you there? Are you ready?
Yes, Prof, I'm there.
Okay, great. So I'll go ahead.
Good evening to everyone, and welcome to the April edition of Chip Talk Africa. I'm called Tembe Keneta, a third-year vet medicine student from the University of Boya. So in this program, I'll actually be moderating with Dr. Sarah. So I'll give her the opportunity to introduce herself before we can continue with the program. Dr. Sarah, are you there?
Yeah, thank you. Yes, thank you so much, Kenneth. Good evening, everyone. Welcome once again to Chip Talk Africa April edition. My name is Dr. Sarah Paul Becky, a recent graduate from Ahmadu Bello University, and I'm interning with War Against Rabies Foundation. Once again, welcome everyone. Kenneth, over to you.
Okay, thank you, Dr. Sarah. So we are about to introduce our first speaker, who represents the scientific foundation of our work. Please, we are going to listen to his bio.
Hail from Michika local government, Adamawa State. Attended Central Primary School and Government Secondary School in Michika. Obtained Doctor of Veterinary Medicine from University of Maiduguri, Masters in Virology and PhD from University of Ibadan. Currently, an Assistant Director and Head of Rabies Diagnosis and Research, Head of Division at National Veterinary Research Institute, VOM. Has several years of experience in research and diagnosis of rabies. Authored several scientific publications, mostly on rabies, in peer-reviewed journals. Contributed to the prevention and control of rabies through organizing/participating in numerous community services, radio/TV programs, and presentations at workshops and seminars. Ladies and gentlemen, Dr. Teki Ishaya-Sini.
Hello. Sorry, was that audible? Hello, did we?
No, ma, the volume was very low. It wasn't audible.
Oh, so sorry. So let me just play it again. But it was playing, just like it wasn't audible, right? Okay, so let me play it again.
Yes, ma'am.
Thank you.
Hail from Michika local government, Adamawa State. Attended Central Primary School and Government Secondary School in Michika. Obtained Doctor of Veterinary Medicine from University of Maiduguri, Masters in Virology and PhD from University of Ibadan. Currently, an Assistant Director and Head of Rabies Diagnosis and Research, Head of Division at National Veterinary Research Institute, VOM. Has several years of experience in research and diagnosis of rabies. Authored several scientific publications, mostly on rabies, in peer-reviewed journals. Contributed to the prevention and control of rabies through organizing/participating in numerous community services, radio/TV programs, and presentations at workshops and seminars. Ladies and gentlemen, Dr. Teki Ishaya-Sini.
Please let us welcome Dr. Teki Ishaya-Sini from the NVRI, who is going to walk us through the laboratory readiness and the journey of a sample. Let's welcome Dr. Teki Ishaya. Doctor, are you there?
Is Dr. Teki there? Okay, he's there. Dr. Teki, you are co-host. Oh, okay, he's sharing his slide. Thank you. Thank you, sir. So you can put it on the slideshow, sir. And we are not hearing you, sir. Okay, great.
Good evening, everyone.
Good evening, sir.
Good evening,
Thank
sir.
you very
Good evening,
much.
sir.
Thank you for the opportunity. My focus is laboratory readiness, and I want to start with an introduction, then journey of the sample, submission from field to laboratory, common breaks in chain that hinder confirmation, diagnosis, and then technical requirement to move Nigeria for the current score, SARE score. Well, canine rabies is endemic in Nigeria. We all know about that and has a significant public health concern. As you all know, Nigeria has since joined the rest of the world to eliminate the disease by 2030. It's an effort being made for the tripartite organizations, and nations like Nigeria are keen into the strategy. And that is evidenced by the launch of its national strategic plan for the elimination of dog-mediated rabies in human in 2022, and also development of national rapid response toolkit adapted from the Global Alliance for Rabies Control and Prevention, which was done last year in November. These are all geared towards strengthening surveillance system, increasing vaccination coverage in dog population, and foster responsible dog ownership, and also enhance multi-sectoral One Health collaboration, which we are doing right now. Well, the journey now of sample from the remote field to the bench. I want to establish that confirmation of rabies is done by laboratory diagnosis. Clinical manifestation is not enough in animal diagnosis. There must be need to confirm it in the lab. And laboratory diagnosis begins with sample collection and transportation. If samples are not collected properly, transported properly, then diagnosis will be hampered. The World Organization for Animal Health has recommended and approved certain methods that are used in diagnosis of rabies in animals. And these are some of the tests. The ones that are highlighted are the gold standard techniques, the direct fluorescent antibody technique. Also, the direct rapid immunohistochemical test, DRIT, can be used. Virus isolation in cell culture. And if where there is no cell culture, can be isolated in mice as well. Immunohistochemical test, conventional RT-PCR, and real-time PCR too. Enzyme link immunoassay, that's ELISA. Then another gold standard technique, in addition to the fluorescent antibody test, is the rapid fluorescent focus inhibition test for serology, for serum detection and quantification, as well as fluorescent antibody virus neutralization test. Now, what samples do we actually need to collect when you want to diagnose rabies? And this includes, depending on the size of the animal, if it's a whole and part of the brain. Skin biopsies can be used for diagnosis of rabies, especially in humans, where ethical issues do not allow collection of brain. The saliva also, it can be collected. Saliva itself, cerebrospinal fluid, serum for antibody diagnosis, then tears, corneal smears, and scrapings are all samples that can be collected and sent for rabies confirmatory diagnosis. But there's a note here: only competent personnel are to collect and send specimen to the laboratory. If the personnel is not competent, he may do a futile job by collecting sample and it's not properly collected, it's not properly shipped. The result may not be available. Before sending any sample, it's also necessary to first contact the laboratory so that they can prepare to receive the sample while fresh and test it at the right time. Sample collection techniques are many, but let's quickly look at the brain tissue. If you want to collect brain tissue, well, the whole skull can be opened to collect the brain tissue by sectioning. And there's another straw method, which is simpler for field work through the occipital foramen of the carcass. Retroorbital straw method is another one. For the saliva, you can use pastor pipette to collect the saliva when it's at the stage of saliva drooling. Then so the swab can also be collected. For serum and CSF, syringes and needle, the regular syringes and needles are used. And then for skin biopsy, special devices will be used, which will include scalpel, blade, and others. Then transportation, which is another key point. Ideally, fresh material should be transported to the laboratory rapidly under cold chain. That is it. But we are talking about remote areas where there may not be access to cold chain, to ice packs and others. If there's no ice pack, it can be preserved in 50% glycerol saline solution. That is glycerol, 50% of glycerol and 50% of normal saline. When it is brought to the lab has to wash it, the glycerol off before testing. That can be done in the absence of cold chain. So for the remote areas, 50% glycerol saline can be used for shipment of samples. Whatever the specimen, the shipment container must be fulfill national regulations. And you can see on the right-hand side of the slide, the kinds of cold chain materials we can use. The first one is this one, is what we call cooler or cold chain. This is another one, and this is another one, whichever is available to you. And as we all know, most of us may know, these are the contents of the cold chain. You have the insulated container, the cap of the container, the dry ice or the ice block, and then the sample is below, and another set of ice block underneath. That is where the cold chain is maintained. Then you have your plastic innerwear, the inner liner of the sample box, and then the insulated container, the outer one, and then the final outer container. When you package and ship your samples, it is safe for whoever is shipping, and it will arrive in good condition for confirmatory diagnosis. But at times, there are breaks in this chain that hinder confirmation. We have experienced that a lot in this place. One of which is poorly collected sample. Sometimes too poorly preserved sample and inadequate sample quantity. Someone will bring some sample, brain sample, in inadequate quantity, you cannot make use of it. And then if sample is not properly collected, like for rabies diagnosis, the hippocampus, the cerebellum, and the brainstem are where the concentration of the virus is highest. But if you decide to collect the cortex, for example, brain cortex, you may not get the virus. You may think it's negative while it is not, because the correct sample is not collected. Sometimes samples come inside nylon, no cold chain at all. This also brings cold chain failure. Limited access to diagnostic facilities is another one. You may think there are no rabies in certain areas, but because there are the diagnostic facilities is very far from them, they cannot access it. Limited or lack of awareness of what to do when there's exposure. Before you know, the dog that has bitten someone or has been killed and roasted, including the head, and consumed. And when you ask of what happened to the dog, oh, it was killed, where is the head? Nobody knows where it is. They don't know exactly what to do. There's high rate of consumption of dog, which I've already said. Ethical barriers too, especially in humans. You may not easily get the brain sample or any sample at all. So poor sample preparation, another one. If in any case inexperienced staff handles the sample from reception, there can be cross mismatch of samples. It happened in a lab somewhere where a farm which was did not have avian influenza was said to have because of cross matching of samples. That can also bring issue. Now, these are examples of kind of samples we receive. This one that you are seeing, plate A, is the fresh dog head submitted for diagnosis. And plate B shows you, samples that is written by maggot. After the dog was buried or thrown away and there's need for diagnosis, people go to exhume the dog head from somewhere for diagnosis. Plate C shows another one, roasted dog head or singed dog head. But you may be able to detect the antigen, but you may not be able to carry out isolation on this kind of sample. And plate D shows a putrefied sample completely. You only find some portions of the brain tissue. Now, talking about the technical requirement to move Nigeria from its current status or score of 1.5 to 2. Actually, as at 2022, the assessment was carried out and Nigeria's score was 1.2. But at that moment, we did not have the National Strategic Plan and the rapid response kit. Probably that is why some individuals say it is at score number 2 for now. But officially, I think it is still at 1.5. But what do we do to move it forward? And you can see on the right side of the slide, these are the stages of progression in getting free of rabies. No data at all, no data, no information is stage 0. Nigeria is not there. We know it's endemic for rabies, and we have some data. Then the assessment was done in 2022, as I said earlier. So now the strategic planning, we have developed the strategic plan, but still we have to do some work on it, such as, allocation of funds must be done so that we can move from where we are, allocation of funds to vaccinate dogs, to vaccinate humans that are exposed, and to plan surveillance activities and send samples where samples are supposed to be sent, train people, and organize awareness on radio stations and communities. Then there's a need for funds, there's a need for collaboration of stakeholders as we are doing right now. There's a need also to take our diagnostic level to higher level so that we will know the epidemiology of the virus in our country to help us to plan further. Then after that, there's a need now to control vaccination. And after that control and no need for vaccine again, you can say elimination has been attained at stage number 4. And then when you get to stage number 4, then the next stage is maintenance of your rabies-free status, as we have for smallpox globally and for rinderpest. So it provides measurable steps designed as a logical flow of activities to progress a country from stage 0 to stage 5. And that is in an effort toward freedom from dog transmission or transmitted rabies. Thank you for listening. I am done.
Well, thank you so much, Dr. Oteki, for walking us through the way samples are collected and processed. Thank you. I hope we are all learning and getting insights. If there's something I've taken from what Doctor has said, is that for every accurate diagnosis of rabies to be made, care has to be taken, right from when the sample is collected to the lab. So care has to be taken, and we have to have competent personnel that will be able to do this. So taking us further, we are going to be welcoming Dr. Sherifat. She's going to be taking us she's going to discuss how lab results are turned into community actions. And can we listen to the bio of Dr. Sherifat? Please,
Just,
can we have
just a minute.
okay.
Yeah.
Dr. Sherifat Balogu Raji is a veterinarian and public health professional with expertise in One Health, antimicrobial resistance, AMR, and zoonotic disease surveillance. She serves as a senior veterinary officer and One Health desk officer with the Agriculture and Rural Development Secretariat, FCTA, driving cross-sector collaboration and outbreak response. She's passionate about food safety and abattoir reform. She leads advocacy and research initiatives to strengthen animal and human health systems. She's also a mentor, speaker, and leader within professional and public engagement platforms committed to advancing resilient, data-driven health systems in Nigeria and beyond. Dr. Sherifat Balogu Raji is a speaker and leader within professional and public engagement platforms committed to advancing resilient, data-driven health systems in Nigeria and beyond.
Sorry.
Committed to advancing resilient, data-driven health systems in Nigeria and beyond.
Sorry for that technical hitch. That's the end.
Okay. Yes. Can you see me clearly?
Yes, we can. Sorry.
Hello and good evening, everyone. Can you see me clearly?
Yes, we can. Do I make you the
So I'd like to.
host, or do I
I think
share
I
your
can
screen?
share my slide from here.
Great.
I can do that from here. Thank you. Okay. I'm trying to put it on a presentation mode. Okay, yes. So good evening, everyone. Good evening, my colleagues, senior colleagues, and everyone present. Today, I will be talking about a focus on the FCT and rabies in the FCT and what we have done in securing the chain of evidence as well as integrating field and clinical suspicion with laboratory readiness and One Health coordination. So these are the outline of my presentation. I recognize I have just 7 minutes, so I have to rush through this presentation. So as a way of presentation or introduction, the FCT is strategically positioned in Nigeria in the sense that it has a population of, I think, over 5 million people living there. And over the years, there has been a change in the security systems of Nigeria, of the FCT. For instance, there has been a surge in significant dog ownership, and this has been because of a high increase of need for security in the FCT, especially within our peri-urban and the rural areas. Dogs has also been increasingly needed for nighttime security and to protect communities, especially within the outskirts. And what has this done over the years? This has predisposed pose as vulnerable in this. Look from the pictures, an elderly woman beaten in her jaw by a dog that we never saw, children beaten in various places from suspected and confirmed cases of rabies. Other conditions or factors that contribute to rabies burden in the FCT is the low level of dog vaccination, poor responsible pet ownership. Despite the fact that more and more people are keeping dogs, we also find out that more and more people do not really care where the dogs are. So these dogs end up just roaming the streets and biting people, moving into the wild, and then getting the rabies virus. There is also inadequate knowledge of rabies in terms of the signs and prevention, even among professionals. And I'm talking about veterinarians as well as health workers within the FCT. There's improper management of dog bite cases. We've seen cases where people who are bitten by a suspected case or confirmed case of rabies go to the healthcare centers and then they have their wound sutured and not properly managed. We have also seen cases where people are not offered the post-exposure vaccines. Rather, they are just given the anti-tetanus toxoid injections, and this is not what is recommended by the World Health Organization or any other organization to start with. Also, there is a cultural barrier to how dogs are interacted with in the FCT, especially within the indigenous Bagi community who consume dog, and they also use unvaccinated hunter dogs, which has increased transmission of rabies in the peri-urban and rural communities. So why do we need to secure the chain of evidence? This falls under two main important reasons. First of all, not securing the chain of evidence leads to loss of rabies cases. When we cannot confirm that this is a case of rabies, then there's no way we can prevent rabies as a whole in the FCT. Rabies, as we know, is 100% fatal, but preventable. And then the gaps that we also saw in the FCT is that bite cases are not usually reported, and in some cases, because people do not know the avenue to report these cases, animals are killed, burnt, or eaten without proper sample collection. I appreciate what the prof said, and these are situations that we've seen time without number in the FCT. Samples are improperly handled or not tested at all. Human and animal health data are not linked together. So what have we tried to do in the FCT? We've tried to ensure that there's an increase in high index suspicion within the FCT. And we did that within the field and in the clinical setting, which is our first link that we need to secure to ensure that we have positive confirmed cases, and then we also have complete data gathered. So we ensure that we do this by flagging off every dog bite in the FCT is given as a signal as a suspected rabies case before confirmation in any form. And this has indeed improved the number of positive cases that we've seen. So what do? We get our sources of information from either the hospitals or the PHCs. And this has been due to a good collaboration with the human medic aspect of the One Health synchronization that we have in the FCT. The state epidemiologist is always ready to receive signals and then send it to the animal component, which is the veterinary clinics and also the leadership in the One Health sector. We also get signals from schools, not really, but from estates. We get from estates, from community leader, as well as security agencies. And what really triggers an alert is usually a dog that is aggressive or has an unusual behavior or excessive salivation or paralysis. I won't go into details of that. So we are also triggered by a dog that has bitten multiple individuals or has an unknown vaccination status. The immediate field actions that we take. Immediately after receiving a signal, which will be in both forms, either the human medic or the animal, we have very little environmental incorporation into the One Health sector. And this is one thing that we are really striving to have them involved in our RRT, that is our rapid response to rabies cases in the FCT. The animal health team usually visit the household after a signal has been received, and that is if it was a case within the household or within a suspected rabies dog. They check the suspected rabies dog for vaccination record, observes for clinical signs, and indeed conducts a thorough assessment of the dog, the environment, and the rest. And then we decide to quarantine. We quarantine if there are two types of quarantine that we usually do. Either the one we take the animal off the environment, or we do a home quarantine, and then we tell the individual the things to watch out for. We follow up these by everyday pictures and videos from the animal owner. And then after 2 weeks of the animal not showing any form of rabies, and then we decide to administer, we advise the dog owner to take rabies vaccination for the animal in cases where the animals are not vaccinated. We also educate on responsible pet ownership. Also, the veterinary clinic usually notify the health system, that is, if the case comes from our own side, and then the human health counterpart usually make sure that these individuals have quick access to the PEP. One thing that is a challenge for us is that the PEP is never readily available, and people scramble to check for places in which they can have easy access to the pre-exposure, the post-exposure human counterpart. There's compliance with how the individual takes the complete dose of the PEP. Laboratory readiness. I must say that we are not there yet, but we are doing a lot to be ready. First of all, the only place in the whole of Nigeria that can confirm rabies as far as the government health sector is concerned is VOM. And then this is a challenge for us. We do not have a laboratory system, despite the fact that we have some competence within the animal health sector, but we are not able to confirm this because we have reagents and some other us transporting the samples all the way to VOM. So this usually requires trained personnel for sample collection, PEP, and biosafety compliance. We ensure that in the process of trying to collect sample, we do not endanger our veterinarians, put them in danger by being beaten and the rest. Proper sampling packaging and labeling. This is something that we are indeed working on. We're trying to ensure that our samples do not come back negative as a result of not being properly labeled or not collecting proper samples. Also, the cold chain transport is another challenge that we have, and we are indeed working on it. One important challenge that the FCT faces is delay in sample transportation, poor documentation, and the limited feedback loop. Usually when samples are sent over, it takes a number of days, although this doesn't stop us from actively dealing with the case in terms of the RRT, the rapid response team, which is a big collaboration between the human health and the animal health sectors. The One Health coordination. Rabies control is not only a single sector responsibility, but for every sector. We ensure that the veterinarians, the human health sector, and the environmental sector, they are not totally in, but it's a thing that we're trying to develop because they play a big role in ensuring that they go into the community and they help us remove stray dogs. And then they are also useful in assessing the environment for dog population and the rest of that. People think that that is a core domain for the veterinarian, but the environment indeed would be helpful and they should be involved in the One Health collaboration. And the community leaders and then security agencies are a key actor in One Health rabies elimination in the FCT. So as the One Health Desk office, we are in charge of coordinating alerts and responding to them. Remember I said every dog bite is flagged down as a potential rabies case. And then we have a good link to the animal and human data. And then we ensure rapid communication and we lead investigation because within the One Health domain, the rabies falls under investigation and an initial assessment being done by the animal health sector. So rabies evidence flow in the FCT. We do this through clear system to ensure that no case is lost. And our current flow of information is from the community, suspected case, or any dog bite. The veterinarians investigate, like I earlier said. Human health refers to PEP. And then we collect sample where applicable in situations where the animal has been eaten, burnt, or buried, or we just can't find the animal. We usually record this as just a probable case. And then laboratory confirmation, and then One Health review. We usually have one health assessment as well as one health review of cases that we have. And then we go into the communities. And this has been done in collaboration with the University of Abuja students. These students are very passionate about eradicating rabies, and they have come in handy in all interventions that we have to carry out when it comes to vaccination as well as awareness. And this has built competence in terms of project management and rabies response cases for these students. And then we report and we document. So what is our priority in the FCT? We intend to prioritize establishing a reporting system through hotlines or WhatsApp, and then to deploy standard case investigation form where when we deploy someone out, the person is not confused about what to do, and they come back with assessment that is incomplete. And then we are trying to ensure that we standardize our laboratories sample collection and transportation system, conduct mass rabies dog vaccination and campaign, and implement school and community awareness programs, as well as have monthly One Health review meeting. This is to understand the challenges that we have, how we could surmount it, and how we could work collaboratively with other sectors of the One Health and other sponsors and funders, so that we ensure that FCT is indeed on the right track to eliminating rabies. So in conclusion, my final message is that we in the FCT, using the One Health approach, are trying to make sure that no bite case is ignored and no case is lost, as well as no life wasted. And with this, we know that we are on our way to rabies elimination in the FCT by the year 2030. So in summary, I'd like to inform you that there are challenges and there will be challenges wherever there is limited access to funding, and then there are also social cultural barriers, and there are indeed challenges, but the FCT is well positioned using the One Health approach to eliminating rabies in the FCT. So I leave you with a quote by Walt Disney. Walt Disney was the creator of many cartoons while growing up, and I particularly liked a quote of his that says, "The way to get started is to quit talking and begin doing." Thank you so much. With this, I come to the end of my presentation.
Thank you so much, Dr. Sherifat, for that wonderful presentation and giving us insight into what you're doing as the One Health Desk Officer for Rabies at the FCT. Despite the challenges, we are seeing what you're doing. Thank you so much for the wonderful presentation. Okay, for students and all our participants on the call, please, you can start dropping your questions for our speakers in the chat box when 3 of them are done, because your questions will be fully attended to. And then there's a form, a data form for students. Please do well to fill it. Okay, so going further, to help us better understand how the chain of evidence is coordinated across sectors, let's welcome Dr. Baba. Can we listen to the bio of Dr. Baba, please?
I'm so sorry. I don't know what's happening today. Contrary to last month. Okay, just a minute.
Sorry, I can't seem to hear anything. Am I the only one, or it's general problem?
It's like the
Same thing over here.
Yes.
I think the major parts have played and we've come to the end because it's finished. So this is a work in progress.
Please, ma, can we have it again? We don't hear it. Yes, ma.
Okay, I should play it again.
Yes, ma.
Okay. Let me stop and share it again. Just a minute. I can't hear anything either. So let me check what's happening. Wow, this is taking a lot of time. I don't know why. Was that audible? Is this sorry, is this audible?
No problem.
No, ma.
Wow. I don't know
We can't hear anything.
I don't know what's happening today. I mean, this is the same thing we've done before. But were you able to see the video playing? Was it
No,
only
ma,
the
your
front?
screen, yeah, the screen was covered completely.
Wow. Okay. Dr. Emmanuel,
Yes, ma'am.
is it still the same? I just played 7 seconds. Is it still the same?
Yes, ma'am, it is.
Okay, Dr. Emmanuel, check your end. Can you play from your end? Is it possible? Or Sarah? Because I don't know what's happening. I don't know why it's not cooperating today.
Okay, ma, can I just go ahead and read his bio?
Yeah, please, let's just have it read. We'll look into what's happening. We'll try and improve on this.
Okay, ma.
Thank you. Thank you very much.
Thank you. Okay, ma. So, helping us understand better how the chain of evidence is coordinated across sectors, we are welcoming Dr. Baba Abdulkadir Umar, a seasoned veterinarian and public health professional with extensive experience in zoonotic disease control and emergency response in Nigeria. He serves as the State Rabies Desk Officer and State One Health focal person for Bauchi State, as well as the resident veterinarian at the Bauchi State Government House. He leads the Rabies Technical Working Group at the Public Health Emergency Operations Center, PHEOC, and is a former secretary of the Nigerian Veterinary Medical Association, Bauchi State Chapter. Dr. A.U. Baba holds a Doctor of Veterinary Medicine and a Master of Public Health with research focused on Lassa fever and is currently pursuing an MSc in Veterinary Field Epidemiology. He has participated in responses to Lassa fever, yellow fever, measles, cholera, cerebrospinal meningitis, diphtheria, and rabies outbreaks across the state. Let's welcome Dr. Baba Abdulkadir. Over to you, sir. Dr. Baba.
Hello, can you hear me?
Baba, you're a co-host. You can share your slide, or do you want me to share yours?
Can you see my screen now?
Is Baba's slide audio? Can you see? Is it visible?
Yes, it is coming up.
Yes, it is.
Okay, thank you.
Very well.
Thank
But
you.
let's have it on slideshow.
It's on slideshow. Or is this showing contrary? From my end, it's showing me that it's on slideshow.
No, it's okay. It's showing on slideshow. It's on slideshow.
Okay, thank you. So is Dr. Baba with us? Dr. Baba, you have the floor.
Good evening, good morning, and eventually good afternoon, depending on where you are listening to us from. My name is Baba Abdulkadir, the Baptist Therapist Officer and focal person. Here today,
Dr. Baba, we can't hear you very well. We can't hear you. I see that you're unmuted, but we can't hear you.
Me now?
Okay, great. We can hear you now.
We can't hear you, sir.
We can't hear you anymore.
Can you hear me now?
Yes, thank you.
Yes,
Sir, we can.
you're welcome.
As a way of introduction, being the State Rabies Drugs Officer for Bauchi State, my presentation will be centered around Bauchi State as a case study. Bauchi State has an estimated human population of 8.3 million, and Bauchi is located in the northeastern part of Nigeria. The state has high population of dogs and cats. These may be attributed to the high demand for dogs, especially due to high insecurity we have recently in the state. And of course, the increase in the number of cats also may be associated with the endemicity of Lassa fever, where most people are now adopting biological control for the transmitter of the virus, Mastomys natalensis. The state also has 2 game reserves. The famous Yankari Game Reserve is conserved, and we also have another Lemebura Game Reserve that is not well known, but because it's not actually conserved, and that contributes to the high number of wild animals that move from the state to other parts of the country. Bauchi is the home of different outbreaks, not that we are so proud of it, but we have outbreaks of Lassa fever. Lassa fever is now considered endemic in the state, currently having outbreak of diphtheria and some pocket cases of CSF. The next slide, I have Bauchi State positive cases of rabies from 2009 to, as we can see, we have cases right from 2009 documented, and you can see in around 2022, 23, and up to 2026 first quarter, we have actually a spike in the number of cases. This may be contributed to the increased surveillance activities we have in the state, and particularly in 2023 also, the increase in the cases may be attributed to a survey conducted by some NVRI and collaboration with some state members, a survey conducted actually targeting the rodents that may be carrying mpox, but then accidentally in the trap, we were able to trap some stray cats. Some of them were sampled. Out of 12 cats, 5 were positive for rabies. That may contribute to the spike we have in 2023. But altogether in 2019, we have recorded 19. And so far, just in the first quarter of 2026, you can see we have recorded 7 cases, confirmed rabies cases. These cases were across different species of animals in equine, donkeys, horses. We have recorded cases in ruminant, both large and small ruminant, and most of the cases are, of course, from dogs, and also a reasonable number from cats. Again, the next slide now is talking about Bauchi State human bite cases. Also, from 2009 to April 2026, even though from 2009 to 2021, we don't have documentation of most of the cases, probably due to lack of the Rabies Dex Office and some issues with record keeping. But from 2022, we can see up to 2026, we have recorded cases 80, 95, 163. In last year, 2025, we have recorded 132 human bite cases, some of which resulted to sampling and others resulted to several instances of quarantine. Of course, quite a number of them were as a result of bite from stray animals, which we could not actually trust the dogs or the cats. The Bauchi State, in the coordination system, we have been able to develop an immediate animal bite reporting system using the heart survey software, where we actually picked once an animal bite instance is picked in the state, the clinician or the area veterinary officer will pick this case and report, and the Dex officer will receive this report immediately, and response can be initiated. Again, also at the state level, we have recently developed a state veterinary hospital case reporting system, where we also have a specific design form for animal bite reporting, also embedded in this system, also to augment the surveillance activity surrounding dog-mediated rabies and other animals, generally animal bite reporting. Now, in Bauchi State, this is the flow of reporting, and this flow includes reporting cases and flow of samples. From the animal health side, we have the clinician or the area veterinary officer that are within the local government level, who will usually pick these cases, a case of animal bite or case of human bite, or a case of a rabies. He will now directly report to the state rabies dex officer using the heart survey software that we have, who will now report to the Director of Veterinary Services. And if there's sample associated with this incident, the sample will now be relayed to the NVRI office in Bauchi, who will now refer or take these samples to the NVRI headquarters in Bob. Again, in this chart, we can see there's an established communication between the clinician or the area veterinary officer at the LGA level and the DSA, or that's the Disease Surveillance and Education Officer, from the human health side. They already have an established communication. Hello? Can you hear me?
Yes, we can, sir.
Okay.
Yes, sir.
Okay. We already have an established communication thanks to the continuous collaboration we have with the human health. We have trained the area veterinary officers together with the LGA team to have a rapid response team at the LGA level. We can also see we have communication between the state rabies dex officer, sometimes also with the LGA DSNO and eventually with the state DSNO or the state EP for coordinated response. Once we pick a case from the human healthcare worker in the facility, who will now report to the facility focal person in that human facility, be it primary, secondary, tertiary facility. The facility focal person, surveillance focal person, also reports to the LGA DSNO, who will eventually report the cases to the state DSNO and link up with the area veterinary officer for a coordinated response also. Whenever we pick a case at the DEX office, we coordinate upwards, we communicate upwards to the clinician or the AVO just to confirm the case has been received and to initiate response, the AVO will immediately respond and then try to establish or produce a spot rep. Let me just go to the activities. I will discuss about the spot rep. In Bauchi State, we have a joint animal and human health response whenever we have a case. When we receive a case of a bite, we initiate response, and this response always carries the three ministries: the health, the environment, and the animal sector. We generate a spot rep and share immediately from the clinician or the area veterinary officer. The spot rep usually contain some of the information that are not yet verified, but that's just to initiate a reporting channel. The area veterinary officer, in collaboration with the local government health team, will move for a full investigation, after which they will now develop a situation report and share. The situation report shared by the area veterinary officer and the LGA health team sometimes will now initiate an activation of the PHEOC, or specifically activation of the instant management system. And then sometimes from the Bauchi State PHEOC and RRT will be mobilized to the state for support based on the situation report we see. Sometimes after the engagement of the state RRT with the LGA, we have to come up with a plan for massive vaccination. This vaccination sometimes may be a ring vaccination, a response to the animals or the area that the incident or the bite happened. And sometimes also it could be human vaccination, where we have to now give post-exposure prophylaxis to the human victims. Again here, we have to also initiate serious risk communication to sensitize the community and the victims on the dangers of rabies and the needs to be proactive, especially in situations where we might not really readily have the post-exposure prophylaxis available. So we have to communicate to them on the risks and then encourage them to go out and start vaccinating. And so immediately we receive the report. If a sample is taken, we ship the sample, and immediately, even before this sample is returned, we have initiated the response and we already have a situation report. So if the circumstances of the bite brings a situation whereby the victim needs to start receiving his post-exposure prophylaxis, that will be initiated, and sometimes from the state will now mobilize and send these samples down to the NGA level, and the victim will start having his post-exposure prophylaxis prior to having the result of the sample. Here again, it is also important to mention that we have adopted the new WHO policy. When we have multiple cases of bite, we have adopted the use of 0.1 ml intradermal instead of using the whole dose per individual. That also helps us along in the control of the disease and also the cutting of the cost. What is working for us in Bauchi State, as I mentioned, we have a functional desk office. This functional desk office helps us in general coordination of activities. From the desk office, we have developed quarterly reports, which we now make a presentation to the Honorable Commissioner and the ministry's the management of the ministry on the state situation of rabies. We also have mass vaccination annually conducted in the state, and then also do vaccination during the World Rabies Day celebrations, where the Nigerian Veterinary Medical Association and other partners also support these activities. We also have in the pipeline already a statewide dog registration and licensing exercise. In this, the governor has already gave approval for this exercise. We are going to conduct a statewide dog registration and licensing exercise, where we also have an estimated population of the dogs and cats we have in Bauchi State, and this will go a long way in responding to the outbreaks and then also collaborating with partners, especially in the area of vaccination and response activities. In the state, we have also vaccinated all the animal health workers against rabies, those that are on the front line. We have also went ahead and vaccinated some of the rangers in the Yankari Game Reserve and in the Sumo Wildlife Park, also being in category of high-risk individuals. We have a strong One Health coordination platform in the state, where we have a data sharing platform. Weekly, we do have a weekly data review meeting where we harmonize data. Some of the cases that came from us and have been reported in the dashboard. And then some of the cases that were reported from the animal health, we now met and then harmonized this data and now established the number of cases we have in that particular week. We have improved surveillance reporting flow also, thanks to the system that we have developed and to also the new system that we have recently enrolled, and one of the LGS has already started reporting. That's the veterinary hospital reporting system. The challenges and area of support, we do have weak or less community level reporting of cases. Sometimes it's when you are investigating a case that you get to pick some information that somebody died due to dog bite, or maybe so victims were, so number of people were bitten by a particular dog. So sometimes the community don't actually report in time. We also have limited rural awareness. Most people in the rural area are not very aware of the dangers of rabies, and we felt that is an area that we need to know. Also, even among healthcare workers, we also have limited awareness of, especially of the clear chain of reporting and what needs to be done to the animal bite victims. We also have issues around responsible pet ownership. Bauchi State is one of the northern states and one of the typical Hausa community that we have a lot of Emfarauta people that keep dogs for hunting. So they also keep a lot of dogs, and sometimes responsible ownership is actually a challenge. We also have challenges in areas of animal welfare, where you see you have the way people handle dogs or people move them during transportation. We also have issues around even dog trading, especially in areas of handling and things like that. We also have serious challenges on logistics issues during case investigations, especially if you need to initiate response at the LGA level. The area veterinary officer and the local government health team needs to move to these communities and do proper case investigation. We also have issues around sample shipments to the set headquarters, which will now be shifted to the NVRI form. Also have issues. We have also issues around vaccines, especially the availability of the vaccine or the quantity that we required at a point in time, also being a challenge, and even the preposition post-exposure prophylaxis. From our collaboration with the Ministry of Health, particularly the primary health care, we do preposition these vaccines in our state cold room, but sometimes it gets exhausted, especially considering the fact that most of these cases come on individual basis, and an individual needs to be given a shot. So before short time, when you buy 200, 500 doses, it usually gets finished, especially considering the number of bites we have in the states. Just January to date, we have recorded 70. Assuming this 70 will be given post-exposure prophylaxis, and each of them will be given probably at least 3 or 5. You see, it's really a huge number. We also have weak feedback loops also, and sometimes we also have delay in result, just like the other presenter mentioned from the FCT. We also do have that issues, but that is really minimal, especially with the up and green veterinary officer we have with the Bauchi State Office of the NVRI. Key message and way forward, my key message today is rabies control is a system. In as long as we didn't take the control as a system, we continue to have issues. Everybody must come on board, and we cannot allow any chain to be broken. We have to make sure that we do the response holistically, and that is the only way we can achieve an absolute control. Way forward, we have to strengthen our One Health coordination. We have to improve real-time data sharing also. Probably we have to expand from the weekly data harmonization to the real data sharing platform that we receive this data immediately from the desk office, which will find the way of maybe probably the health and the environmental counterpart also to receive the same data at that same time, so that the response can be well coordinated. We also need to expand our community awareness. We need to invest more on logistics and our surveillance tools. And we also need to have a sustained integrated response system, which will go a long way in controlling rabies in our dear state and our dear country at large. Thank you so very much. It's the brief of what I have for us. Thank you. Over.
Thank you so much, Dr. Baba Abdulkadir Umar, for that very exciting section. If you've not taken anything, from his section, just know that rabies control is a system. No weak link is allowed. So the importance of integrating field, clinical, suspicion lab, everything, One Health. Rabies control cannot be done by one sector alone. It is a chain. And so there's no room for any weakness in this chain. Thank you so much, sir, for the insightful session. Thank you, all our speakers tonight, for such wonderful sessions that we've had. So we've had some questions. We'll be going to the question and answer session immediately. We've had some questions already in the chat box, directed specifically, some to that are specifically directed. I will call on my co-moderator, Kenneth, to ask questions that have been directed to Dr. Kek.
Student Dr. Kenneth, are you there? Kenneth?
Yes, Prof. Just that I had a little breakdown in the network.
Oh, okay. Okay. Welcome back.
Okay, from the questions that have been asked to Dr. Teke, so what are the most critical chain of custody that's factors that ensure your lab continues to provide a more rapid and valid result from a field sample?
Okay, can you hear me, everyone?
Yes, sir.
Yes, sir.
Okay, thank you very much. It's a practice to train and retrain personnel, because training and retraining is key to, for rapid turnaround time and for accuracy and accuracy in results. In producing results, we do train our staff regularly and retraining, and from time to time, carry out competency assessment of each staff. Maybe giving a staff blind sample. Okay, you run this sample. Meanwhile, the supervisor has the results and give blind sample to them and test the competency of the staff. And secondly, we as a laboratory participate in the inter-laboratory proficiency test, which are organized by OIE reference laboratories. We have done that with a lab in France, a nursing lab. We have also done it with another lab in Padova. They are both reference laboratories to ensure our competency. Many labs do that, and the results are sent to each lab to know your performance, and that keeps us on our toes. Then among other labs within the institute right now, QMS, that's quality management system, has been adopted. And in quality management system, it is expected that things are done in the right way, including turnaround time and producing ongoing. And it's expected that after the training, the particular procedure for rabies diagnosis will be accredited. And after a few years, there will be assessment by external assessors to ensure that we still maintain our accreditation. So these are the rundown of efforts being made for such in the institute right now. Thank you.
Thank you very much, Dr. Teke. We have one more last question for you. How does the NVRI plan to improve readiness for samples arriving from remote locations with limited infrastructure?
Well, you know that we have The 23, you may not know, but we have 23 outstation laboratories in a situation where, since there is no central means of sending samples or transporting samples to the lab right now, and some states hardly send samples. And sometimes you discover that throughout a whole year, a particular state has not sent sample. So they can leverage on the availability of our outstation laboratories, where they can send their samples to the closest one to them, and they will forward it to us over here. And then this is what we are doing, and it's quite available. Then right now, storage of samples, all over the country, I'm sure there's no state that is not affected by poor power supply. It's a challenge we've been having. You want to run test sample and there's no power. Right now, there's a funding body, the US-based funding body, who is helping the institute to bring in better power supply to the institute right now. It's ongoing at the moment. That will improve our readiness to receive sample and churn out results as fast as possible. Thank you.
Thank you so much, sir, for your response to those questions. We have a question here directed to Dr. Serifat. The first question here says, what do you do with stray dogs that are arrested in our community? And how do you ensure they don't end up being consumed to further check non-bite transmission?
Okay. We said, how do we handle stray dogs?
Yes, ma'am.
So stray dogs are not directly the mandate of where I work at the Agric and Rural Development Secretariat. Actually, the handling of stray dog and ensuring that they don't become a nuisance to the community is a part that is under the mandate of the Ministry of Environment, state and federal. However, when we go out to this, when we attend to cases using in our team of the RRT, we usually give recommendations to them so that they know how to handle the situation, although definitely with our own support. So I think the second question was there were two questions.
Yes, ma'am. The second question is that what measures have we put in place to create awareness about reporting dog bite cases?
Okay. Yes. So yes, having complete data is a challenge in the FCT, and that is because of we are not fully utilizing all avenues that needs to be utilized. We rely mostly on cases that come to the veterinary clinics, the government-owned veterinary clinic. There are a few of them in each LGs of the FCT, just a few of them. And then we rely also on signals that are sent by the state epidemiologist and the health secretariat of the human medical aspect, you understand? So we also rely on signals that are picked by NGOs and supporters. We have the OHDI, the One Health Development Initiative, headed by Dr. Kiki Okwe. She has websites that are easily accessible to people. So we also take signals from places like that. So finally, what you said is what is being done to ensure that people know about this. The FCT, in collaboration with the NVMA, does consistent radio broadcast about rabies. We also do community engagement with the local community leadership, and then we go to schools. There was even a time that we collaborated with the NVMA and then Professor Griskia and our foundation, and we went to over 20 schools just talking to people. But there's always a challenge of follow-up. there's always, first of all, we are indeed short-staffed. We have just 45 veterinarians, about 44 veterinarians in the whole of the FCT that has to attend to a population of millions, and then population of several thousands of dogs and cats and other animals who are also warm-blooded and could contact rabies within the wild and within our households. So what we do is, anytime there's an outbreak and we attend to it, we take it as an opportunity to communicate with the people within the community, their leadership, the church, the mosque, the schools, and the rest. It is not enough until everyone indeed understand the risk of having a suspected rabies dog case close to them, or just keeping dog generally without vaccinating them thoroughly. I know that's not enough, but that is what I and my team within the ARDS are working on day and night consistently. These are challenges that we met on ground, and these are challenges that we would not be deterred. We will keep on working until the FCT is rid of stray dogs as well as unvaccinated dogs. Many times we face another challenge where people wait only till the World Rabies Day to have their dogs vaccinated. That's a terrible thing to do, which means that you have a dog and you are just waiting for someone else to handle the vaccination for you and the rest of that. We also have people who use dogs as hunter dogs, and these are many abattoir workers and other local communities. These people reject vaccination because they believe that when their dogs are vaccinated, they become more docile and they are not very active when they go into the wild. But the thing is that when these dogs go into the wild for hunting, they are most at risk of contacting rabies. Let's not forget that rabies exists within the wild with coyotes and jaguars and some other wild carnivores, and they maintain this without showing signs of rabies. So when our local dogs or hunter dogs go into the community, they may likely pick it up, and then the hunters and the rest of the communities become at risk of contacting rabies. So I hope I've answered that properly. Thank you.
Thank you so much, ma, for the response given. So we have a question for Dr. Baba. Dr. Baba, somebody asked, if we map the chain from field to the lab, would you say that the most critical failures are visible failures, that's like lack of labs, or they are invisible failures? Example, sample degradation, delayed transportation, and poor coordination.
Just come again. I didn't hear you well. You were cracking.
Oh, sorry. Somebody asked that if we are able to map the chain, that is from the field to the laboratory, would you say that critical failures are those that are visible? That is, example, the lack of labs, or those that are invisible? That is sample degradation, delayed transportation, and poor coordination.
Well, for us in Bauchi State, we may have challenges in transporting samples, but it's very limited because we have area veterinary officers with supporting veterinarians in each LGA. In Bauchi State, we are blessed to have quite a number of vets. We have over 150 veterinarians in the state. And so we ship these samples properly. 2 years ago, we have invited NVRI to come and even train all veterinarians in the state on sample packaging and processing. So we have limited issue around that. The only limitation we have, sometimes the cost implication in shipping samples from the LGA headquarters to the state headquarters. That's an issue. But for most cases within Bauchi and some LGA that are neighboring the state headquarters, we have limited issues, and most of the time samples get to NVRI state office in a good shape, and some shipping them from NVRI state office to the NVRI form has actually not been an issue. I never received a report of a degraded sample or a sample I sent from Bauchi State that the lab may never be able to process. We have limited challenge actually around that.
Okay, yes. Thank you, sir. There's another question here for you. The question is that you in the course of your presentation, you mentioned that there are a number of cats rated rabies in Bauchi State.
Yes.
So the person is asking that, do you consider cat vaccination, or sorry, in your vaccination exercise, do you consider cats as well, or is there a separate vaccine for cats?
Okay, thank you for the question. We have been recording cases of rabies in cats over the years. In fact, one of the striking one was one of the positive cases in 2026 that involves a family. The daughter was first bitten. Later on, the mother was bitten by her own cat. And then when the husband was trying to, pick the cat as natural, husbands trying to send her out of the house, she also bit him. When we get the report, we move to the field and then eventually get that cat, and that cat turned out to be positive. So we have series of cases of cats in the state. Now on the vaccination, just like I mentioned, we are planning to do the statewide vaccination in the closest while we already have approval from the states. So it's just the release we're waiting for. This year, we have planned to include cat vaccination in our normal statewide annual vaccination. And for the specific vaccine, we have been applying for NVRI, I think from 2 years ago, to produce the specific cat vaccine for us, but there were challenges around that. So what we are planning to do, because for the live vaccine, the cat and the dog have specific vaccines. One have high egg passage and the other one have low egg passage vaccines. But when you want to use a kill vaccine is a vaccine that you can use in dogs and also use in cats. So we are looking at the possibility of using the kill vaccine this year for our cats in the state. And if we can position this in the state, even with the private outlets, people can come and vaccinate their cats. Especially, we have quite a number of cats in the state. Yeah, thank you and over.
Thank you so much, sir. So, I will call on Kenneth to ask the next set of questions.
There are questions.
Kenneth, are you there?
Yes, I'm there.
Sorry.
Okay, please go ahead.
To Dr. Teki, we have a question that is there any effort by the government to provide standard reference laboratory across the 6 geopolitical zones?
Okay, thank you for your question, Doc. Well, NVRI is not in position to establish laboratories. We have, across geopolitical zones, but I know what you are saying is that are we intending to upgrade some of our outstation laboratories to a standard one? Actually, there should be one reference laboratories, but there are other ones also in the zones that can test the samples and send some adequate quotes for confirmation. Yes. Well, we have submitted that many times to government, but we are hoping and waiting for that to be done. The facilities are there, but there may not be funds right now in order to equip the facilities. For the training, we are capable, we can train them. We have done that before, but you can be sure that many of them who have been trained before have retired or are no longer in the service. So there's that plan, but we are hoping government will give us what we need in order to do that.
Thank you very much, Dr. Teki. There is still another question for you.
For drug vendors, right?
Yes, sir.
Yeah, drug vendors, as a vet, you know that only qualified or competent individual should handle vaccine, a veterinarian or someone under the supervision of a vet. But as we speak right now, many years ago, I worked with a company, Pfizer to be precise, and we used to go out to the markets. I saw rabies vaccine being displayed in the market, just like any other drug. Vaccine that's supposed to be under cold chain in the open, nothing like cold chain. But as a veterinarian, I didn't have the powers to apprehend anybody. But as an institute, if we come across it, we can do something legally. That happened somewhere in Nasarawa State a few years ago, not rabies vaccine, another vaccine. We discovered that some people were faking our vaccines, and we called the authority, the police, to arrest them, and that place has been closed. But the resources may not be available for us to do surveillance, go around and make arrests. But if we see, we report to the authorities to make arrests and shut down. So the answer is vendors are not supposed to sell vaccines or handle vaccines. But those that are selling vaccine are registered under supervision of a vet. They come to us with a cooler and give them under a cold chain. Before, I've seen people carrying vaccine inside carton without ice packs, but that has stopped now. You must come along with your chain, with your cooler, and then vaccine is given to you under cold chain. Over,
Thank you very
please.
much. Thank you very much, Dr. Teki. I'll give the floor to Dr. Sarah to ask furthermore questions to the other presenters.
Hello, time is running. We've exceeded our 6:30. Dr. Sarah Becky, can you run up the questioning? Is she still here?
I think maybe she's having an issue with her network.
Okay.
Well, I think some questions.
I will. Okay, sorry. Go ahead, sir. Let's make it a little bit faster.
Yes, there was a question on if we have an emergency hotline unit that handle dog bite cases, and if we also have fosters in the state. Just like I mentioned in the course of my presentation, we have a rapid response team even at the LGA level that have a coordination between the human health, the environment, and the animal health. These are what we use for immediate response on any dog bite incident. At the state level, we have the emergency rapid response team from the PHEOC that are trained to respond to various infectious diseases, and if need be, those can also be mobilized to support the LGA in response. Then for the IEC material, we may have challenges around that, but we have some readily available to be utilized, especially when we have cases that we need to do massive community engagement and during our World Rabies Day celebration in the state. Ma, permit me to just briefly appreciate you, Ma, and the team for giving me the opportunity to be part of the presenters. The Bauchi State DSNO also joined this meeting. I also have Dr. Habila Samaila from Afinet Bauchi, who has also joined this meeting. I also have the publicity and the financial secretary of the Nigerian Veterinary Medical Association Bauchi chapter that have been publicizing this activity and have eventually joined us. The animal health lead for the L-Press Bauchi office, also Dr. Samuel F. Minor, is with us. And I also want to specifically appreciate my class rep, Dr. Jarumi Barnabas, for also joining and giving me support, and my closest friend, Nuruddin. Thank you.
Thank you very much, Dr. Baba, for that. there are some questions on the chat that are still hanging. I want to give the opportunity for a few people to just quickly, from the War Against Rabies Foundation, to quickly respond to some of the questions. I see Dr. Teresa is here. I see Dr. Jerome is here. I don't know if you can quickly pick a question and quickly respond to them within a minute, if possible. Is Dr. Teresa still with us? I want to thank all the people that have joined this call. Dr. Teresa, yes, you can pick a question that is hanging there and respond to it. Thank you.
Yeah, hello.
We can hear you.
Okay, thank you very much. I don't know which question to pick. I think there are some few here. I'm trying to look at the, because initially I was just listening, I didn't view the questions, but
Okay,
let me look at it.
Let me just pick, what is the, okay, so there's this question. If a rabid animal bites a cattle, can it become a victim? Yes, how,
Yes.
Cattle be prevented?
Yes.
How do you prevent cattle from anti-rabies vaccine? I don't really understand the question, but I think the person.
Okay, I think I do. I think
Mhm.
he's trying to know how cattle can be prevented from rabies, and he's trying to ask whether anti-rabies vaccines can be given to cattle. Yes, if a rabid dog bites an animal, definitely we'll have cases of rabies in dogs, in goats, and also some cattle. I know we have seen rabies in cows and all that. So yes, if a rabid animal like dog bites a cow or a cattle or cattle, definitely the animal will go down if the dog is rabid. And how to protect or prevent this scenario to happen? I think the best thing is for whoever has this animal to try and confine your animals. First and foremost, we'll start from not just the animal itself. If you have dogs around or you own a dog and also you are keeping or rearing animals like cattle, sheep, and goats, you should try and vaccinate your dogs. It is very, very important. Try and vaccinate your dogs so that your animals will not be exposed to this. Then naturally you can will have issues of stray dogs and all that. Yes, you can prevent this. But if, for instance, you are trying to let's say maybe I know you are trying to ask whether anti-rabies vaccines can be given to animals like cattle and all that. I think it's possible, but economically it's not wise enough to do that. So rather the best way is just prevention, trying to prevent your animals from being bitten by dogs or allowing your animals to stray generally, not just dogs alone. Trying to keep your animals more like an intensive form of farming. That's what we're even encouraging in the whole country. It's very, very important. If you keep your animals indoors or try to keep them confined in a place, it will save you the stress of these animals being exposed to some of these dogs and the rest. So yes, if a rabid dog bites your sheep, goat, or cattle, they will come down with rabies. Thank you very much.
So somebody
Just right there to.
Okay, go ahead. Who is speaking?
Just right there. One of the cases
Okay,
we recorded last year in 2025 was actually a case of a herd attacked by a fox in Kirpi local government of Bauchi State. No, it's bordering the Yankari Game Reserve. So a fox just dashed out from the reserve and beat 10 heads from his herd. And those 10 animals, one after the other, came down with rabies. He lost all the 10. We only got the information on the last case. That was when we picked the case and then we sent the sample to NVRI and it came back positive for rabies. And that one was not actually even from a dog, but from a fox dashing out from the game reserve. So these cases are real and we always have them in the field. Thank you.
Thank you very much, Dr. Baba. Let me just mention this before we get to the end. Dr. Jeremy, so talking about not waiting for World Rabies Day, we've had a number of our partners and members of also War Against Rabies Foundation with other states working throughout the year to do vaccinations in various places and also awareness campaign. Recently, I'm mentioning this because recently, Dr. Jeremy Barnabas, who has a clinic in a veterinary hospital clinic in Zaria, has been doing some vaccination for dogs at a rebate. So just in case you're in Zaria, please, you can check Vet Medics. Vet Medics is Dr. Jeremy's clinic in Zaria. So please check that out. And then somebody asked a question about somebody mentioned vaccination of cats. I don't know if the person got adequate response. So we have in the country, we have our own vaccine from own NVRI is the low egg passage, and it's for dogs. We do not have high egg passage in production presently. So you cannot use NVRI vaccine for vaccinating cats. I repeat, please do not use NVRI vaccine to vaccinate cats. I have had this question raised in a few instances, and it's very important because some people have mistakenly vaccinated cats with the low egg passage vaccine from NVRI. You are just helping us to propagate rabies among our cats, and we don't want that because there's going to be virulent in them. So please don't use the NVRI low egg passage. Since we don't have the high egg passage, like Dr. Baba said, we use the killed vaccines that are foreign, that are coming from other countries to vaccinate cats. We have used BioCats before, we have used Boehringer Ingelheim vaccines before, etc., Zoetis vaccine. So please, let's re-echo it to our colleagues so that this kind of mistake does not reoccur, because we are only just going to end up causing problem rather than solving problem. Thank you very much. And then, so there's another question, is a follow-up to Baba's question. It says, do you have emergency phone line? I don't know if you have responded to it. Dr. Sharif Khan has told us what happens in Abuja, what they are planning to do. Actually, ideally, there should be a WhatsApp chat that is used for communication between all the stakeholders in any state, any community. You should have WhatsApp chats for easy communication. Baba, I don't know, do you have any of such? Are there posters, handbills that tell the general public the line of action to take once there is a dog bite? That's what somebody's asking.
Yes, ma'am.
You can quickly respond to that.
Yeah, I partially responded to it. I say we have posters right now as I speak. In all the clinics, we have posters posted around sensitization on rabies, yes.
Okay,
and then
thank you.
for the emergency response, we use the rapid response team in the local government areas, whom we have trained to respond to various diseases, rabies inclusive. So they respond together with the health team and report back to the state.
Thank you very much, Doc. I missed that. So there's a follow-up question for you. Anybody else can answer anyway. Please, if there is a case of dog bite, I think Dr. Jerome should quickly respond to that because we had similar situation that we responded to this week. Please, if there is a case of dog bite and there is no proof of rabies vaccine, what happens to the dog? Do you kill the dog to get sample, or what should you do to the dog? Dr. Jerome, are you close by to respond to that question?
Yes, ma'am.
Okay, quickly,
good evening,
please.
Everyone. So that's always an interesting case. If the dog that beats the dog ran away and you're not sure of the transmission sex of that dog, then you get as rabies exposure. So if the dog that was beaten has no vaccination history, the idea is to mercifully euthanize the dog so that dog does not serve as a vector for rabies spread. But the argument is always, what is the need of vaccinating dogs against rabies? When they are bitten by suspected rabies dogs, they have to be vaccinated.
Okay, Jerome, the volume is too low. We don't hear you.
Yeah, I'm not picking. I'm not picking either.
Okay, let me
Okay, can someone?
Okay, so
Okay, go ahead. Quickly, please.
So I'll use my normal voice now without the earpiece.
Okay.
I said if a dog is bitten by a
suspected dog and the dog is not vaccinated, the best thing is to immunize the dog. In other cases where they've gone ahead to
against rabies,
the wound will be treated.
It's becoming worse now. I don't know.
Let me just come in.
Can I answer this question?
Okay, can we just have Dr. Sherifat respond to that question quickly? Thank you.
All right. Yes, thank you very much. So I think the person is trying to ask if there is a case where there's a dog bite case. So maybe the person is saying that the dog has bitten a human being, right? That's what I perceive from this question, but I'll answer it either way. So if a dog has bitten a human being and the dog doesn't have any vaccine and there's no proof of vaccination, what should be done? Usually what we do is to quarantine. We do two types of quarantine. We quarantine either home or on facility for over 2 weeks. We check for signs, we assess the dog. And if after a period of 2 weeks or a little bit above, we decide to just carry on another vaccination while we check for an additional 2 weeks to check if the dog has any signs of rabies. So now, if the question were to be that if a rabid dog should bite another dog, what should be done? So this was a case that we had last year. There was a case of a fictitious veterinarian who went around injecting water and lying to the dog owners. This individual has had 3 dogs, usually allow them roam in the night, and they may have picked up the rabies in the wild or whatever. So, but one of the dog attacked the wife, and it was a terrible situation. At the end of the day, we had to carry the dog and do the necessary. It was confirmed positive. But this dog had also bitten another dog in the household on his eyelid. And you know, cases that are close to the neck, the head, and the rest of that, usually they have higher access of getting into the central nervous system and the rest than those far in the extremities. So what actually happened was these owners were so attached to their dogs and they wouldn't allow us carry out what we needed to do. They were so attached and we didn't know anywhere else. We quarantined for a period of 2 weeks, but the dog owners were scared. We were also scared. So at the end of the day, we did a rapid test. After doing the rapid, those 2 dogs tested positive and they had to be put down. So in cases where a rape suspect, a confirmed case has bitten another dog, I think the best thing is to put those dogs down. So that rabies is endemic in Nigeria. For any disease that is endemic, prevention is usually better than cure. So that's what I have to say. Thank you so much.
Ma is a case I handled just this weekend.
Okay.
Maybe it's something that I think War Against Rabies and other partners should also take a look. I usually get issues when it comes to days for quarantine. I have documented cases of dogs that were bitten much longer than 2 weeks and then coming down with rabies. In my own report in Bauchi, I have documented cases of dogs we picked as routine sampling and sent to NVRI. I came back positive. Dogs that just died due to maybe helminthosis or something, and we took the head and sent to NVRI and came back positive. So this weekend, there was a case, and then she was like, okay, 2 weeks. I wanted to say, okay, 2 weeks, but I had this fear because the dog that bit her dog was already confirmed to be rabies. So this issue of 2 weeks, it's really something that the stakeholders need to take a look at. In the cases I've recorded in humans, remember the case I called you last year, that the person died before we took the sample. He was bitten 8 months before presentation to Bauchi. And he eventually died with clinical rabies. We wanted taking sample, but he died before the morning. The other case I lost in 2024 was also a boy that was bitten 5 or 6 months before presenting symptoms, and he died. And also, when we were in school, there was a sheep you quarantined in Lajasma clinic that came down with the rabies longer than 2 weeks. I think around 3 weeks or more. So this issue of giving 2 weeks is real. And some of the people, when you say 2 weeks, immediately after 2 weeks, they release these dogs. And sometimes these dogs will now come down with rabies after 2 weeks.
Okay, so let me just quickly...
Yes, ma'am.
Yeah, sorry, Doc. So I just want to quickly respond to your, just because of time. Sorry for interrupting. So you see, we have the period of incubation period, and we have the period of communicability. When there is a dog bite, and you have the dog that has been bitten by another rabid or suspected rabid dog, right? You need to know the vaccination history of the dog, one. That's of course, the one that you are suspecting might not have any information on vaccination, because maybe it's a stray dog, or maybe it's an own dog that is free roaming, right? So let me just back up a little and explain that, generally we do not have, our situation in Nigeria, in Africa generally, is that we have dogs that are roaming for their own. So we call them free roaming dogs. The stray ones are those that have left their community, most likely because they are rabid, and moved to another community because they don't even have control of their senses. So we have free roaming dogs, and in the case of rabies, we have stray dogs. So somebody asked, also, there's so many questions, I don't even know which one to handle, which one. But somebody asked, the questions are so many. Okay, so let me just get back to what I was talking about. So when there is an outbreak, that is when a rabid dog, there is a suspected rabid dog on the rampage, whether you are able to get sample and the sample comes back as positive, or the dog ran away and nobody could catch the dog and get samples from it, or the dog was killed by the community and burnt, so you don't have samples. But based on clinical history, the epidemiological signs, clinical signs show that this dog is most likely rabid. Maybe it has manifested those clinical signs that are pathognomonic, like, unprovoked bite, the dog is maybe changing character in behavior, etc. You treat the situation as though it is a rabid dog. So whether the sample was collected and it was sent to the lab and result came back as confirmed,
Thank you.
or the dog was not captured and samples were not taken because it ran off and nobody could get it, or the dog head or the dog was burnt, or and the samples were not gotten. But there are clinical signs, history that shows that this dog might be rabid. It's a suspect, probable case. Then you have to treat the situation as though it's rabid by doing outbreak investigation, and then the most importantly, that ring vaccination is very important. So the issue that we have had is follow-up vaccination of the community. Ring vaccination is what has been missing, because you will not know how many dogs or how many animals or humans were exposed to this dog that beat this particular case that is being presented. So based on a period of from the time that the dog manifests that biting, because normally is when the dog bites somebody or an animal that people consider is the first manifestation. However, 3 to 5 days before that manifestation, the dog would have been secreting this saliva. And secreting this virus in his saliva even before that dog bite, right? So when we're doing when we're quarantining a dog, talking about incubation period of 14 days, we are looking at the fact that 3 to 5 days before that bite, this dog would have been secreting this virus. So all in all, if you keep the dog for 10 days, right? Most of the time, the dog would have come down, will die, right? But this incubation period is certain for dogs, for cats, but it's not certain for wildlife, sheep, goats, cattle. I mean, there's so much to say, and that's why I keep putting this WHO academic course, so that we can go and read for ourselves. There's just so much in rabies to say that the time wouldn't permit us. But please don't use 14 days for other animals. This is for dogs and cats. But for sheep, cattle, some wildlife, it's not applicable. It has not been fully researched yet. So, and remember that we also have the period of quarantining the animal that was bitten by a suspect animal. You know, we said you should quarantine this animal that is under, because many people don't want to allow you to kill their dog because a rabid dog bit it. So we go ahead and vaccinate that dog that was bitten by the rabid dog, so that, but then after you vaccinate, you can't allow the dog to be roaming around. You have to quarantine it for 45 days to 6 months. I'm trying to use simple words so that everybody understands. Quarantine it for 45 days to 6 months. You observe it. That's the dog that was bitten by a suspect rabid dog or a rabid dog, right? But please, it's so important that we do ring vaccination when there is an outbreak. Otherwise, believe me, there are dogs that have been bitten, cats that might have been bitten, humans that might have been bitten that we don't know about. So we do rabies investigation to know the number of humans that in that community that might have been bitten that didn't report, and we also do ring vaccination so that the dogs that were exposed will be vaccinated to prevent them from coming down to rabies. Peradventure, maybe we don't know that they were exposed. So I was trying to be fast. I'm sure I must have made some blunders when I was saying, when I was trying to explain. Well, please, let's try and do the WHO course. I don't know if somebody else has anything to say quickly, but I want to take this time to thank everybody for being here. We started when at the point we were 92 people in attendance, and right now we are 50. So people have gone, some have gone to pray, some have gone to do so many things, cooking, etc. I just want to thank each and every one of you for coming. Our presenters, thank you so much for your time. Dr. Sherifat Balogun, Dr. Baba, Abdul Kadir, and then our chief, Teki Ishaya Sini. Thank you so much for your time. I know if we had given you a whole day, you would have continued to talk to us about rabies because of the so much knowledge you have. And guys, we are not coming here to talk because we have perfect situation. The states, communities are far from perfect. There are problems, and we are meeting to talk about what we have achieved so far and the problems that still exist. So please, we'll look at these problems, and I'm sure many funders or organizations that are working on One Health or rabies could take a look at our YouTube, and you might be giving them information from your presentation. So we always ask people to come and just share with us the way it is. And that's why we are grateful to our presenters for all that they have shared. Thank you so much. Thank you so much, the War Against Rabies Foundation team, for putting this together. So there are just too many for me to mention the names. Shelson, Ari, thank you for attending. Michael Sati, Michael, thank you. Kwaja, Elizabeth, God, you guys have been so awesome. Thank you so much for always attending our meetings. I can't go on calling all the names, but for now, thank you and thank you. Our beautiful moderators, Sarah, and our handsome Kenneth. Thank you very much for moderating for us. Thank you, the senior colleagues that have been here. Dr. Baba has introduced a few of them. There are so many, I can't go one by one, but we're really so grateful for your time. Thank you for taking this almost 2 hours to be with us. Oh, it's actually more than 2 hours already. Thank you very much. Tamana, thank you. Do have a great day, a great Tuesday. And we look forward to seeing you again next month ending. Thank you so much for being part of this talk show. Thank you, Dr. Jerome. Thank you, Jeremy. Thank you. So you can actually leave at any time. Joseph Alta, thank you. Thank you very much. Dr. Gloria, wow. I should have allowed you to say a few words. You have so much to say from Ebonyi. Don't worry. We're going to have time with you soon. David Oladotun, thank you very much for attending. I'm impressed that students were able to take time despite their exams that is, is starting tomorrow. Momo Sunday, thank you for attending. Habila Ismaila, thank you. Dr. Obeta, thank you so much for attending. Fatima Husseini, we're grateful. Ibrahim Yakubu, thank you so much for attending. There is this Vivo account that has asked wonderful questions. Thank you. Damar, Anthony Mary, thank you for attending. Shitu, yeah, thank you. Thank you so much for attending. Emmanuel Onoja, thank you. Abubakar Ladan, thanks for attending. Wow. Nice to see you guys. Ahmad Muhammad, thank you for attending. Zara Nuhu, thank you for attending. Adisa David, Onyeka Oboma, thank you. Khadija Salau, thank you for attending. You guys are awesome. Wow, thank you for the encouragement. Anthony Mary, thank you for the encouragement for attending. We look forward to doing more works together. Adida Patience. Wow, thanks for attending, Adida. It's been a while, huh? I think you asked a question. I don't know whether we're able to answer it. God, it was so much. I think maybe what I would do, I might just do a video and answer some of these questions with some friends and then post it so that people can just go and get the answers, just in case I was I was trying to put too many things in a short time. Joseph Alta, thank you for attending. Augustine Isaac, thank you so much for all that you've been doing.
Thank you very much, Professor. Thank you.
Adida, thank you for attending. Wow, I'm impressed. I'm encouraged.
Glad I did not miss this section.
Thank you so much, ma'am.
Very educative. Thank you so much.
Thank you so much, ma'am. We're grateful for attending, ma'am.
Time.
Dagwa Mark Vren, thank you so much for attending. This is a unique name, Dagwa. Thank you for attending. Jeremy, how is it Saudi Arabia or is it Dubai? Tamana, thank you for attending. So you guys have a good night rest. Thank you so much for staying this long with us. God bless you all. Bye.
Thank you, Prof. I'm doing fine. Thank you so much.
Jeremy, thank you. Sanufa, how is the work? Dr. Jerome, sorry, your network was messing up.
Yes.
Sorry. So we had to just call somebody else. Dr. Damar of WHO Bauchi. Okay, that's good. This Bauchi really attended to encourage their One Health Desk officer. So, guys, do have a good night rest. Thank you so much for attending. Ruben, wow, there's a new name here.
Thank you and goodbye.
Good night. Thank you, Garba Saleh. Thank you so much.
Good night, Prof. Thank you, ma.
Oh, Sarah. No, you're here. Oh dear. Thank you so much for all your help. God bless you. Thank you
Amen.
so
Thank you,
much.
Lord.
Thank you so
Thank you.
much. I love your blogs and all the Instagram posts. Quite interesting.
Thank you, man. Thank
Your
you so
husband is in
much.
trouble. Thank God he has a good sense of humor too. Augustine Isaac, thank you so much. All right. I don't know who has this Samsung SM. I don't know name, so I can't even say much about you. Thank you so much for attending. Samsia. So you're here. I didn't know. So me, I'm closing I'm closing the Zoom link. Good night, everyone. Love you guys. Thank you.